welcome to a sobering reality of modern medicine. In our quest for better health, we often turn to pills, little capsules of relief, wrapped in hope. But as the years go by, the very remedies meant to heal can quietly become the source of deeper harm. Aging brings wisdom, yes, but it also brings a change in how our bodies work, especially the kidneys. Once efficient, these delicate organs gradually lose their edge. They become more vulnerable to the chemicals we absorb, particularly from medications. And here lies the hidden danger. With age often comes a longer list of prescriptions. Blood pressure pills, pain relievers, antibiotics. All meant to help, but some of them, silently, begin to chip away at our kidney health. These drugs can overwhelm the kidneys, causing waste to build up and filtration to slow down, sometimes without any warning. If left unnoticed, this damage can evolve. From mild imbalances to full-blown kidney failure. Doctors call this phenomenon drug-induced nephrotoxicity. It's a serious condition that affects older adults more often, especially those with pre-existing kidney issues. And not all kidney injuries from medication are the same. There are two major types. Dose-dependent toxicity: the more you take, the more damage accumulates. Idiosyncratic toxicity: unpredictable and unique to each person, sometimes striking even at low doses. In some cases, the safest option isn't to adjust the dose, it's to avoid the drug entirely. These harmful effects might originate from different pathways: muscle tissue breakdown, rhabdomyolysis, kidney tissue damage, renal infarction, or acid buildup in the bloodstream, renal tubular acidosis. Over time, these can spiral into larger issues: protein leaks, electrolyte disorders, and other complex kidney syndromes. But here's the good news: knowledge is power. In this video, we'll take you through a clear, insightful journey to uncover which common medications may pose a risk to your kidneys. More importantly, we'll share safe strategies to minimize harm while still managing your other health conditions effectively. Remember, it's not about fearing medications. It's about understanding them. So join us as we pull back the curtain on kidney safety and empower you with practical tools to make better, safer decisions about your health. Oh, and before we begin, rest assured. Every word you hear today was created by real human hands and guided by expert-reviewed knowledge. No automated AI writing tools like ChatGPT were used in content creation. You're receiving trustworthy, human-verified insight made with care, for people like you. Now, let's uncover the truth about medications that might be hurting your kidneys. Number 7. Antibiotics. They're trusted, common, prescribed with ease. Antibiotics often arrive in our lives as little capsules of hope, handed over with the belief that they'll restore balance after an infection. But not all that heals comes without consequence. If you've ever taken antibiotics for a sore throat, a urinary tract infection, or a skin issue, you may have unknowingly exposed your kidneys to risk. Let's take a step back. Antibiotics, also known as antimicrobials, are drugs designed to fight bacterial infections. They either kill bacteria or stop them from multiplying. That's their job. And when used correctly, they can save lives. But here's what's often left unsaid. Some antibiotics can quietly damage your kidneys. Drugs like Cipro, Bactrim, Flagyl, Augmentin, and amoxicillin are household names. They're commonly used to treat pneumonia, UTIs, strep throat, and skin infections. But they are useless against viruses like the common cold or flu, and yet, they're still often prescribed for those. According to the CDC and the Journal of the American Medical Association, nearly 1 in 3 antibiotic prescriptions in the US are unnecessary. That's millions of kidneys being burdened without cause. And even when prescribed appropriately, certain antibiotics come with risks. 3 classes in particular are known to be nephrotoxic. Polymyxins: these can rupture kidney cell membranes, leading to acute damage. Aminoglycosides: they accumulate inside kidney cells, slowly killing them off. Vancomycin: effective against resistant bacteria, but harsh on kidney tissue. While the exact mechanisms remain under investigation, most experts agree inflammation, oxidative stress, and cellular injury are key players in antibiotic-induced kidney damage. Why does this happen? Because your kidneys are the primary filters. They work tirelessly to remove waste, including excess medications, from your blood. But with age, their filtering power declines. The older you are, the more vulnerable your kidneys become. So what can you do? Ask questions. Stay informed. Next time your doctor recommends antibiotics, don't hesitate to ask, is this the best option for my condition? It's not disrespectful, it's responsible. Most doctors will appreciate your thoughtfulness. And if antibiotics are truly needed, stick to the dosage exactly. Don't stop halfway just because you feel better. Never save leftovers or give them to someone else. Every prescription is tailored to the person, not just the illness. Because true healing doesn't come from killing bacteria alone. It comes from caring for the very organs that keep you alive, silently, steadily, every single day. Number 6. Anti-inflammatory medications, NSAIDs. You've probably taken them at some point, maybe after a long day of aches, a swollen joint, or a persistent headache. Ibuprofen, naproxen, aspirin, Celebrex. Even over-the-counter options like Motrin or Advil. They're part of a powerful family of drugs known as NSAIDs, non-steroidal anti-inflammatory drugs, and over 30 million people worldwide rely on them daily. They're meant to soothe pain, reduce inflammation, and help us bounce back from minor injuries or flare-ups. But here's what most people don't realize: these everyday painkillers can quietly harm your kidneys, especially as you age. To understand why, let's look beneath the surface. NSAIDs work by blocking an enzyme in the body called COX, short for cyclooxygenase. This enzyme helps produce substances that trigger pain and inflammation. So by suppressing COX, NSAIDs can offer fast, effective relief. But there's a trade-off. COX also plays a critical role in maintaining blood flow to the kidneys, regulating how your body handles salt and water, and protecting the kidney tissues under stress. So when NSAIDs block COX, they don't just dull pain, they can also disrupt the kidney's delicate balance. And that's where the danger begins. NSAIDs can lead to acute kidney injury, or AKI. This risk is especially high in older adults, those on high or prolonged doses, or individuals with existing kidney concerns. Two key mechanisms are often involved. Reduced blood flow to the kidneys, NSAIDs can constrict blood vessels, limiting circulation and causing short-term kidney dysfunction. If sustained, this can lead to more severe outcomes like acute tubular necrosis, where kidney cells die from lack of oxygen, and eventually, full-blown kidney failure. Inflammation of the kidney tissue. Though NSAIDs are anti-inflammatory, long-term use may paradoxically inflame the very structures they're meant to protect, especially the renal tubules where waste is filtered from the blood. This isn't just theory. It's backed by data. A 2006 study published in the Journal of the American Society of Nephrology followed over 10,000 individuals prescribed NSAIDs. The findings? A 26% increase in acute kidney injury, especially within the first 30 days of starting the medication. Other research tracked 99 patients with chronic musculoskeletal pain who used NSAIDs for a year. Most experienced declining kidney function, but once they switched to alternative pain relief methods, their kidneys began to recover. Statistically, it's estimated that 1 to 5% of all NSAID users suffer some level of kidney injury annually. That's up to 2.5 million people every year. And for some, the damage leads to emergency hospitalizations or worse. What's the lesson here? Pain relief should never come at the cost of long-term organ health. If you're relying on NSAIDs regularly, especially beyond a few days, it's time to reassess. Speak with your doctor about alternatives, whether it's adjusting your dose, limiting usage, or switching to safer options. Because behind every moment of relief, there could be a kidney quietly struggling to keep up. Number 5. Diuretics. At first glance, they seem helpful, like a built-in plumbing service for your body. Diuretics, often called water pills, are frequently prescribed for conditions like heart failure, chronic kidney disease, liver cirrhosis, or high blood pressure. They work by prompting your body to expel excess salt and water through urine. For many patients, this can bring fast relief from swelling, fluid buildup, or dangerously high blood pressure. Commonly used diuretics include hydrochlorothiazide, HCTZ, Furosemide, sold as Lasix. Bumetanide, Bumex. Spironolactone, found in aldactone. Acetazolamide, in Diamox. Some of these can be bought over the counter, but most are prescription strength and much more potent. Here's where the story gets more complicated. Diuretics are often praised for their ability to lower blood pressure, a major win for kidney health. But while they don't attack the kidneys directly like NSAIDs might, they can still cause trouble in quieter ways, especially if misused. How? It's all about dehydration. Diuretics remove water from your system. But when taken in high doses, or without enough fluid intake, they can tip your body into dehydration. And dehydration, in turn, is one of the fastest ways to trigger acute kidney injury, even in people without pre-existing kidney problems. A hospital-based study looked at 131 patients who developed acute kidney injury while using diuretics. The findings were eye-opening. 96.2% of them already had at least one underlying health condition. 55% had chronic kidney disease before taking the medication. Nearly 1 in 3 cases of acute kidney damage were linked to diuretics alone, with no other drugs involved. The takeaway? Diuretics aren't inherently dangerous. But they must be respected. They work best when used carefully, under medical guidance, and when you stay properly hydrated. If you already live with chronic kidney disease or diabetes, extra caution is needed. Regular electrolyte checks, kidney function monitoring, and hydration strategies become essential. Fortunately, today's technology offers simple home test kits, allowing you to monitor your kidney function and electrolyte balance from the comfort of home. So yes, diuretics can help. But like any strong tool, they can cut both ways. Speak with your healthcare provider. Know your baseline kidney function. And never assume more water loss equals better health. Because when it comes to your kidneys, what you flush out might come at a price. Number 4, proton pump inhibitors, PPIs. They're everywhere. In medicine cabinets, in supermarket aisles, even in airport kiosks. Proton pump inhibitors, commonly called PPIs, are among the most widely used medications in the world. From omeprazole to pantoprazole, these drugs are trusted by millions to silence heartburn, calm acid reflux, and treat GERD. They promise comfort and often, they deliver it. But here's a truth that's far less known: your kidneys might not be as comfortable with them. PPIs work by targeting a powerful enzyme in the stomach lining called hydrogen potassium ATPase, more simply known as the proton pump. This enzyme plays a critical role in acid production. By switching it off, PPIs can dramatically reduce stomach acid. Sounds great, right? And yes, for short-term relief, PPIs are generally safe. But long-term use, especially without medical supervision, can quietly chip away at something much more vital: your kidney health. One of the most concerning risks linked to PPIs is a condition called acute interstitial nephritis, AIN, a type of inflammation that affects the spaces between the tiny filtering tubes in the kidneys. Though rare, PPIs have become one of the leading medication-related causes of AIN in developed countries. What makes it dangerous is how silent it is. AIN often develops without warning signs, no pain, no visible symptoms, until kidney function has already declined. For some, this means a sudden onset of acute kidney injury, AKI. For others, the damage slowly builds over time, eventually leading to chronic kidney disease, CKD. But that's not the only concern. Long-term use of PPIs has also been linked to hypomagnesemia, a condition where magnesium levels in the blood drop too low. And magnesium is essential. It keeps your heart rhythm steady, supports nerve function, and helps balance electrolytes. When magnesium falls, several dangerous processes can begin. Electrolyte imbalances. Kidney inflammation. Cellular damage that accelerates kidney decline. A 2019 study published in the Journal of Pharmacotherapy followed over 93,000 individuals. It found that PPI users were 4.35 times more likely to develop acute kidney injury than non-users. In a second group of 84,600 participants, those on PPIs had a 20% higher risk of developing chronic kidney disease. That's a significant price to pay for heartburn relief. Other long-term side effects of PPIs include Infections due to reduced stomach acid. Bone fractures. Nutritional deficiencies like vitamin B12 or iron. So, what should you do? If you're taking a PPI, especially over a long period, speak with your doctor. Get your kidney function and magnesium levels checked regularly. Ask if a lower dose or shorter duration might work for you. In many cases, lifestyle changes like adjusting your diet or meal timing can offer equal or even better relief. Remember, a short-term solution should never create a long-term problem. Don't let the remedy become the root of something far more dangerous. Number 3, ACE inhibitors. They've been called protectors of the heart. Lifelines for those with high blood pressure. And for many, a shield for the kidneys. We're talking about ACE inhibitors, short for angiotensin-converting enzyme inhibitors, a class of prescription drugs used widely to manage hypertension, heart failure, and kidney-related complications. You might recognize them by names like lisinopril, brand name, Zestril; perindopril, Altase; enalapril, Vasitec; benazepril, Lotensin. These medications work by blocking an enzyme that produces angiotensin II, a substance that narrows blood vessels and increases blood pressure. By stopping it, ACE inhibitors allow vessels to relax and widen, reducing strain on the heart and improving circulation. Interestingly, this improved blood flow doesn't just benefit your heart. It also enhances kidney perfusion, making ACE inhibitors especially helpful for those with chronic kidney disease, CKD. They can even reduce the amount of protein leaking into the urine, a key marker of kidney damage. That's why, for many doctors, ACE inhibitors are part of the first line of defense in kidney protection. But like most medications, their power comes with responsibility. ACE inhibitors don't directly harm the kidneys. But under certain conditions, they can tip the balance toward acute kidney injury, AKI. This risk increases when ACE inhibitors are used alongside NSAIDs or diuretics. The patient is dehydrated. There's underlying heart failure or blockage in both renal arteries. So what's actually happening? One concern patients often raise is a drop in their eGFR, the estimated glomerular filtration rate, a common measure of kidney function. ACE inhibitors can reduce eGFR slightly, but not because they're causing damage. In fact, this drop usually reflects reduced pressure on the kidney's filters, which may actually be beneficial in the long run. Still, in some individuals, this drop can be too steep, especially in those with already compromised kidneys. In such cases, a doctor may adjust the dosage or pause the medication to assess the situation. Rarely, in severely dehydrated or unstable patients, ACE inhibitors can trigger acute renal failure. But here's the hopeful part: in most cases, kidney function fully recovers after stopping the medication, even in patients who needed temporary dialysis. So, should you stop taking them? Not necessarily. For patients with heart failure, diabetes, or CKD, ACE inhibitors often provide long-term protection. They help the kidneys do less work and resist further decline. But they must be monitored carefully. The key lies in balance. Adjust doses based on kidney function. Stay hydrated. Get regular blood tests to monitor electrolytes and eGFR. Used wisely, ACE inhibitors don't weaken the kidneys, they help shield them. But ignore the signs, mix them with the wrong drugs, or push too far, and even a helpful medicine can turn into a hidden threat. Number 2, antiviral medications. Viruses come and go, sometimes leaving nothing more than a cough or fever in their wake. For most infections, our immune system fights quietly in the background, needing little help. But there are times when the battle is too intense, the virus too stubborn. That's when doctors turn to antiviral medications, powerful drugs designed to suppress or slow down viral replication. You may have heard of them in the context of COVID-19, seasonal flu, genital herpes, hepatitis B or C, HIV, Ebola. In milder cases like the flu, medications such as oseltamivir, Tamiflu, or zanamivir, Relenza, can help shorten illness duration. In chronic infections like HIV or hepatitis, antivirals can't offer a cure, but they can reduce symptoms and viral load, improving quality of life. So where's the problem? Your kidneys may be paying the price. While antiviral drugs have transformed the fight against dangerous infections, several of them pose serious risks to kidney health, especially if used over long periods or in individuals with pre-existing kidney conditions. How do they harm the kidneys? Some drugs are directly toxic to kidney cells. Others crystallize inside the kidney tubules, blocking flow and leading to stone-like deposits. In either case, the result can be acute tubular necrosis, where kidney cells begin to die off. Let's take remdesivir as an example, widely used during the COVID-19 pandemic. It contains a compound called SPECT, which is primarily eliminated through the kidneys. In patients with reduced kidney function, this compound may accumulate, triggering toxicity. The research is still emerging. Global safety data shows a noticeable spike in acute kidney injury, AKI, among patients treated with remdesivir compared to those on other COVID-19 therapies. And it's not just remdesivir. Other high-risk antiviral agents include cidofovir, tenofovir, adofovir, foscarnet, acyclovir, interferon, atazanavir. These drugs may reduce blood flow in the kidneys, damage tubular cells, or cause inflammatory injury to the interstitial tissue surrounding the kidney's filtration system. In some cases, crystals may form, especially with acyclovir, foscarnet, or indinavir, which clog the kidney's delicate channels, blocking the outflow of waste. Even though a few antivirals like cidofovir and foscarnet are used to manage kidney-related conditions, they must be administered with extreme caution, as they also carry a high risk of kidney damage. So how do we use antiviral drugs safely? Never skip doses. Irregular intake can lead to antiviral resistance, making the medication ineffective. Avoid self-medication. These drugs are only prescribed by professionals. Do not buy them online or through unverified sources. Always monitor kidney function if you're on long-term antiviral therapy. Blood tests, hydration, and medical supervision are essential. The mission of antiviral therapy is to stop a virus in its tracks. But if we're not careful, we might also slow down or even shut down the kidneys along the way. Number 1, lithium. For more than 6 decades, one small element has offered stability in the stormy seas of mental illness. Its name is lithium, a prescription medication that has saved lives and restored balance for countless individuals living with bipolar disorder and manic episodes. It's found in medications like Priadel, Camcolit, Lisconam, or in liquid form, such as Liliquid. Lithium works by helping to regulate brain chemistry, smoothing out intense mood swings, from euphoric highs to crushing lows. For many, it is the difference between chaos and calm. But while lithium steadies the mind, it can destabilize the kidneys. Over time, long-term lithium use may lead to serious renal complications, including acute and chronic kidney disease, the formation of kidney cysts, and in rare cases, end-stage renal disease, ESRD, a condition requiring dialysis. One of the most concerning side effects is a condition known as nephrogenic diabetes insipidus, not to be confused with blood sugar-related diabetes. Here, the kidneys stop responding to a hormone called antidiuretic hormone, ADH, which helps the body conserve water. Without this response, the body loses control over fluid balance. The result? Excessive thirst. Frequent urination, especially at night. Signs of dehydration, like low blood pressure or rapid heart rate. And in severe cases, mental confusion or altered consciousness. In rare situations, if lithium use is not carefully managed, it can progress to irreversible kidney damage. But the dangers don't stop there. Lithium can also cause the kidneys to waste sodium, leading to a dangerous condition called hyponatremia, where sodium levels in the blood drop dangerously low. If this drop happens rapidly, within 48 hours, it becomes acute hyponatremia, a medical emergency that can cause rhabdomyolysis, muscle breakdown, severe confusion or seizures, coma, or even death. So, what can be done? If you or a loved one is taking lithium, vigilance is key. Maintain a balanced diet with adequate salt and fluid intake. Avoid extreme low sodium or low fluid diets. Get regular blood tests to monitor kidney function and electrolyte levels. Watch for signs of dehydration or mental changes. Before starting lithium therapy, always inform your doctor if you have a history of kidney disease, heart problems, thyroid issues, respiratory conditions, Addison's disease, or Brugada syndrome. Lithium is powerful medicine with the ability to restore mental clarity. But it demands respect. Used wisely, under close supervision, it can be life-changing. Used carelessly, it can be life-threatening. Have you ever wondered? Could the medication you're taking right now be quietly harming your kidneys? If that question has crossed your mind even once, don't ignore it. Seek professional medical advice immediately. Because in kidney disease, early signs often whisper. And by the time they scream, it may be too late. As kidney function worsens, symptoms may appear such as reduced urine output, swelling in the legs or ankles, shortness of breath, extreme fatigue or weakness. If untreated, these signs could signal a life-threatening condition. So stay aware. Be proactive. If you're taking any of the medications we've discussed in this video, especially antibiotics, NSAIDs, diuretics, PPIs, ACE inhibitors, antiviral drugs, or lithium, monitor your kidney health regularly through blood tests for creatinine, glomerular filtration rate, GFR, urine tests for protein levels. And don't forget the simplest kidney helper of all, water. Drinking enough fluids each day helps your kidneys flush out sodium, urea, and toxins, lessening the burden these drugs may place on them. Also, never underestimate drug interactions. Even medications that seem harmless on their own can turn risky when combined. That's why it's crucial to share your current medication list with any doctor or pharmacist before starting something new. The truth is, medication can be life-saving. But for those with kidney disease or high risk of developing it, certain drugs must be handled with extra care. Why? Because some medications can directly damage kidney cells, alter blood flow to the kidneys, disrupt electrolyte balance, leading to dangerous complications. To manage this wisely, work closely with your healthcare provider to choose safer treatment options, adjust doses appropriately, schedule routine kidney function checkups. But let's not forget one more thing. A healthier lifestyle reduces the need for medication in the first place. Make room for habits that support your kidneys naturally. Eat a balanced diet with lean proteins and fresh vegetables. Exercise regularly to keep blood flow strong and blood pressure stable. And if you're serious about protecting your kidneys and learning how your body truly works, subscribe to our channel and turn on notifications so you never miss content that could literally save your life. Stay informed. Stay strong. Stay kidney-wise.